So mesothelioma is a very unusual cancer, and it's an unusual cancer both because of how it's caused and how it behaves. It's caused by a substance known as asbestos. People who work with asbestos are at very high risk of getting mesothelioma, and indeed prior to the ban, those individuals who were exposed perhaps 30 or so years ago have now gone on to develop the disease. We have around about 2,000 patients a year being diagnosed, and we anticipate this is going to increase significantly over the next 10 years or so. The feeling is that over the course of the next half century, we'll have seen historically much higher numbers than have ever been seen before. If you go back to the early 70s, this was an exceedingly rare disease, and what we're clearly seeing is the effect of this exposure many years ago. People working directly with this material, but more recently, and also those individuals with indirect contact, teachers, we're seeing pupils even presenting who may have had exposure through their contact in schools, for example.
I came into contact with asbestos when I was a bride. I just got married and Ray was working in Chatham Dockyard, and so I was so pleased I could do his washing, and I had a new washing machine to do it in. You had two. You had a spin dryer and a boiler. But in doing that, he worked with asbestos and he brought it home on his clothes, and I didn't know the dust that I was shaking away had this asbestos in, and I must have breathed it in at that point. In 2008, my arm went numb, and I was told that I had a trapped ulnar nerve by my doctor, but I wasn't happy about that. I went to Benidorm, and when I came back, in the motorhome, so for 2 months, and when I came back, I really was getting breathless, and I had to go to polling station in the May of 2008, and I couldn't walk up there. I found myself so out of breath. I'd already had an x-ray, the doctor had sent me for an x-ray. When I got home, he phoned up and said, "You've got your x-ray report, it looks bad, so you look like you've got fluid in there." He said, "I've booked a bed," and so we had to rush into emergency, and they drained 7 litres of fluid. And in that fluid, when you test it, there was the cancer cells, mesothelioma.
This is a really devastating diagnosis to receive, and the reason for that is that this is an incurable cancer. The patients will ultimately live the rest of their lives with this disease, and we would say on average actually that survival is about a year. Now there are some individuals who can live a lot longer than 1 year, but there are also most of patients who will have disease that can progress within that year and obviously shorten their life because of that.
At the time I was diagnosed, I was devastated. It was between me and the doctor who told me, but I had to stop him because he started to describe what was really there, and I had cancer and a tumour, and I said, "Stop." I thought I could do this on my own. I said, "Would you wait till my husband came in?" And he said, "Okay." So when Ray came in, that was when he told us that I had mesothelioma. He suspected it, and I was given 3 months to live. I would never call it cancer. I would only talk about mesothelioma because I didn't want cancer involved, and I've only just started to really talking and describing it as a cancer. You're devastated, and shock isn't. You're very shocked. But I didn't cry, and I've never cried, and I've never been angry. I just thought, right, now we'll fight it.
For mesothelioma, the only standard treatment that we have available is really drug-based treatment, and that's with chemotherapy. Now in the UK and worldwide, we only have one standard of chemotherapy, and that's pemetrexed and platinum-based drugs. The patients will receive a course of treatment that may extend to about 4 to 6 treatments. But once they've had treatment, that's pretty much it. There's not really much more available in the way of standard of care. And so clinical trials, by and large, form a really important option for patients in whom we want to maintain quality of life and extend life. There are trials, and the UK is really pioneering randomised trials in surgery, and also we have a number of randomised trials currently enrolling in radiotherapy in the UK.
I'm the only person to have survived to 5th line down in Kent and Canterbury. And so they just don't know what to treat me with. So I've been travelling around trying to find, using the computer to search for something that I could have. I need it today, tomorrow, because I might not be around soon.
I think we're getting a lot more intelligent about how we design the trial. For example, one of the trials that we're involved in is about trying to stabilise the cancer after chemotherapy. This type of treatment is called maintenance therapy. And the drugs that we're using to do this is a drug that can do two things. First of all, it can target a group of cells called stem cells. These are the cells, seeds if you like, which, although in a minority within the cancer, essentially give rise to the cancer itself. If these cells are growing, the cancer comes back, and if they're not growing, the cancer should be quiescent and stable over longer periods of time. Chemotherapy may actually aggravate these cells, may actually cause the cells to grow, the stem cells. And so having a drug that can target these specifically, I think, is extremely important and very novel. The second thing about one of the maintenance studies that we're involved with at the moment in the UK is that the drug of interest that we're studying has also the property of being more active in a particular mutation. So half of mesotheliomas seem to carry a particular mutation in a gene called NF2. If a cancer has NF2 mutation, then we think this drug will work more. And the more common this mutation is within the disease, the more likely it is that this drug may work. And so I think with mesothelioma in particular, because we've never had a trial of this type conducted before, there's every probability that we may have some benefit for patients.
What I've been doing since diagnosis really, I wanted to make everyone know about asbestos and how dangerous it is in their house still. People don't realise it's still in their house. They don't realise it's when they decorate their house and do DIY, you're putting the dust everywhere again because it's in things like Artex. And I found it in my fire in the year 2000, sitting in electric fire, brand new fire. Because it was imported, it must have been caught in there. But it's in the cement dust, it's in air conditioning pipes, everywhere.